Good morning. This is my second product market fit video. This is a cover of Army Futures Command Concept for Medical 2028. It's a 50-page high-level document. Army Futures Command has reviewed what our warfighters will need given what modern weaponry can do. A couple of the quotes that I pulled out. Army health system requires novel methods of burn wound assessment and treatment that can be utilized near point of injury, have limited logistical footprint, and do not require specialized training or equipment to administer. With regards to the assessment component, we have a severity guide and a rule of nines right on the back. It's on the back of the kit, okay? You don't have to recall anything. You can have extensive medical training or limited medical training. It's right there for quick reference. With regards to do not require specialized training or equipment to administer, years ago when I was first working with Dr. Missy Thompson and her undergrad students at Fort Lewis College, I had no website. There was no instructional material out there. I had all my devices laid out in a row on a table, and this was early proof of concept work. And her undergrad students that had no clinical experience picked up my devices and they intuitively applied them to the correct anatomy. And that let me know, as a medical device inventor trying to simplify and expedite patient care, make it effortless for this super delicate flesh to be treated, that basically tells me that what the Army is asking for here, we hit that nail right on the head. New capabilities are needed to treat wounded tissue, prevent delay or treat infection, mitigate tissue damage from wounds at echelon when evacuation is delayed and surgical care is not immediately available. Okay, with regards to the infection component, as a wound care company, we seem to be the only ones out there doing a preformed anatomically shaped device. Multiple layers where the interior layer is sterilized and protected. Like white goes to wound, blue goes to you. It's a non-adherent absorbent. It goes on effortlessly and intuitively, and it protects that infection-prone flesh. And if that medic, if he or she, when they have that delayed transport patient, if they have some antimicrobial spray or some topical agent, they can apply it to that wound bed, and then the emergency dermal kit goes on right on top of it. It complements those more advanced interventions. Future forces will occur casualties at unprecedented rate, scale, and dispersion with a high degree of simultaneity. Managing mass quantities of casualties with blast and burn injuries will consume significant equipment and resources. Okay, mass casualty incidents as a medic or as a non-medic person. I've sat in on multiple civilian and military medical conferences where they talk about 1,000 casualty days. So we need to understand that as a paramedic or as a military medic, what that may be like. If I have 5 or 50 or 100 blast injury burn patients, I need to be able to isolate and protect that flesh immediately while my head is on a swivel and I'm considering scene safety or other threats to me or the men and women I'm in charge of providing for. Traditional wound wraps, they take too long, they're tedious. Ultimately, we'll neglect that exposed flesh, and especially in a mass casualty scenario. We have 25 people injured in front of me. The idea that I can provide wound care by individually wrapping each extremity or body part one by one, it doesn't make any sense. The emergency dermal kit makes mass casualty response effortless. So that's our second product market fit video. Thanks for listening.